Hi, my name is Dane Coleman. I'm doing my presentation on genograms. Right here is a diagram of a potential genogram in the making right there. A definition of a genogram. Genogram is a diagram outlining the history of the behavior patterns such as divorce, abortion, or suicide of a family member over several generations. Also, a similar diagram detailing the medical history of a family member in order to assess a family member's risk of developing a disease. So the risk of developing the disease, that could be, genetically inherited. So that's what these diagrams will capture. What is a genogram? A genogram is structurally similar to a family tree. However, it operates for a very different purpose. A genogram typically showcases specific information about family relationships and interactions between family members, while a family tree only shows a family line. So it's more detailed, as a genogram is. Just not who married who and who had these children. A genogram, as it says here, is more specific. A genogram gives specific details about how family members interact with each other. For example, a family tree might just show us that Emily and Kevin are married, while a genogram would tell us that Emily and Ken are married, but they are emotionally distant from one another. So like I mentioned before, the genogram gets into more detail about the marriage, the dynamics. You can even get even more detail than that. A genogram becomes more valuable when it includes information about several generations. So the more information, the more information that you have on your grandparents, parents, just more generations that you have, the better. Established patterns that are usually hard to decipher seem to jump out once they've been mapped on paper. So maybe you've already noticed a trend of marital problems or marital trouble in a family's history, but the genogram can highlight the pattern of aloofness and anger that's at the root of all marital problems. So it gets into getting into detail, like we said, the root of the problems of the genogram. The origins of the genograms. Genograms were first developed and popularized in a clinical setting by Monica McGoldrick and Randy Gerson through the publication of a book in 1985. Genograms are now used by various groups of people in a variety of fields such as medicine, psychology, social work, genealogy, genetic research, and education. There are many books and websites on the topic of genograms. Genograms, a closer look. Let's look closer. So here, genograms generally contain a treasure trove of information about a family. Genograms typically contain basic data found in family trees, such as the name, gender, date of birth, and date of death of each individual. Additionally, the data presented in a genogram may include education, occupation, major life events, chronic illness, social behaviors, nature of a family relationships, emotional relationships, and social relationships. So see, like we're talking, it's getting deeper into the specific relationships of individuals that are in this family. Also, genograms can include information on disorders running in the family, such as alcoholism, depression, diseases, alliances, and living situations. Genograms can vary significantly because there is no limitation as to what type of data can be included. So they can vary. So we can, more information that you may need specifically, but it definitely may vary. Uses of genograms. So genograms are used by various groups of treatment professionals in several of fields such as medicine, psychology, social work, genetic research, education, and youth work, to name a few. So just in my field, because I'm in the psychology field, I am a behavioral health consultant. I've been at Children's Hospital for 12 years now, and so in my field of psychology, I've noticed that the social workers, we use a genogram to just get the background of the family history, because a lot of times the kids come in the hospital with several diagnoses, if it's PTSD, if it's ADHD, bipolar, and speaking of bipolar, so the social worker may have information that their grandparents, that the maternal or paternal grandparents was bipolar, and just getting a bigger overview of the family history. And so that's what a genogram will capture. And I can see the benefits of the social worker needing this information, because as what I work with different social workers and doctors and psychologists, this is the family history that we need to kind of see where the kid came from. So this kid may be diagnosed with a disorder, but we may not know or capture the fact that, okay, the grandparents had bipolar, or this other grandparent was schizophrenic. So once we know this information, we have this, which the genogram captures, it's beneficial in our treatment and kind of realizing what best needs for the patient. If it's medical needs, or the doctor can prescribe different medicine based upon history. Because if like I said, if the social worker finds this information, it's very beneficial for us in helping the child that comes to our hospital and to our care. So just touching base on different treatment teams and professionals that would need a genogram, which we use and we need as well in my profession. So most social work practitioners in personal and family therapy use genograms alongside sociograms for personal records and to explain family dynamics to their clients. So definitely use these to explain the family dynamics to their clients as well, which is definitely beneficial. Now, creating a genogram, there are several steps in creating an accurate during this step. So you would be creating a basic outline of your 3 to 4 generational genogram, and noting all family members, relationships, and deaths. So you'll note, the deaths of those different relationships and different family members for about 3 to 4 generations. During future steps, you would expand on the details of your genogram and include dates, relationship dynamics, patterns. But right now, you would just focus on the 4 fundamental steps. So here, you use your family tree. This is actually explaining. Right here, you have a family tree, so you draw a basic genogram, beginning with the individual's current family system. You start with a person's current family. This includes the individual's parents, and if the individual lives at home, or if individual's partner, or if an individual lives with him or her. And so you'll put this in the family tree. Just starting off, with this family tree dynamic, and then you can get into details later about if this relationship was emotionally unconnected, this marriage was not emotionally connected, or if this parent or this parent had say they had problems with alcohol, I could be transparent about my specific genogram. My grandparents struggle with alcoholism, and so in my tree specifically, I could go to my grandparents and outline the fact that they did have some emotional distance, and there was, alcoholism, within my family tree with my grandparents. So just looking at that, and just looking at the history of my person, I'm personalizing this too, of alcoholism and emotionally distant to one another in my grandparents. So just to see, and just trickling down, I can go down to my family member, just to get more in detail. That's what a genealogy, a genogram is going to provide more information in detail, and like the details that I just gave you about my generation of grandparents. So tools to creating a genogram. These are just, I thought this was just a funny picture, but just having some tools for creating a genogram. So yeah, some tools here. Creating one. GenoWeb. So I found here on GenoWeb that there are several websites online that will assist anyone that's seeking a genogram. So if you need help, trying to make one, these are some websites that I found. Genoanalytic.com. You got the eddrawmax.com genogram, the genogram maker, getmine.com genogram, the maker, and the GenoPro, different templates. So if you have time, you can kind of look through these if you want to get through your, just kind of creating your own genogram, and starting maybe with your generation. And a genogram as an assessment tool. So genograms are an important assessment and intervention tool in social work practice that allow client and clinicians to explore family relationship dynamics. So this is what I touched on earlier, and this is why I feel this is beneficial. The genogram would be beneficial for our social workers. Our social workers do get a lot of background information. I work with the hospital, but I'm not sure. I know they're not they're familiar with the genograms, but they're not shown or used in the family tree setting. They do have information from like the grandparents, and as far as the great grandparents, but they don't go several generations with the child or the patient that we're dealing with. So they may go as far as just the grandparents, and the details that they have that the social workers may share with the team, with our treatment team, is the history. If they have history of illnesses, if they're bipolar or schizophrenic, like I mentioned before, these are some things that they have. The social workers have information that I work with. Also, if they're married, if they're divorced, they have that information. But I think this is a good assessment tool to dig deeper into family history. It'll be beneficial for our social workers, for our clients, for our patients that we work with as well. Getting more of an overview of the type of patient that we have, maybe even the whys of why this patient may act the way they act, or have these type of behaviors or symptoms that they have, because it may be genetic. So we are looking at a bigger picture of if it's in the mother or the grandparents. These are what genograms can provide for us. So provide definitely an assessment tool. Clients and clinicians can create genograms to provide insight into clients' families' relationships, to focus on intergenerational relationship patterns. So just like we mentioned before, the different patterns that we have in relationships with the if they're married, divorced. It is as an assessment tool. The genogram allows clients and clinicians to examine family structure in detail and secure clinically sound information related to the quality and characterization of relationships. So it's definitely get into the depth of the family structure and the dynamics, and that's what a genograms will do. So after assembling the genogram, the information produced, the client and the clinician can examine ways the family processes play out across generations. So once you assemble this genogram, you can kind of see the dynamics and how it's playing in that child's particular situation. Um, if it's, we can even talk about the domestic violence. We see that a lot in our patients at the hospital. So if their parents experience domestic violence, it can even trickle down from the grandparents having domestic violence and drug abuse. We have a lot of drug abuse, and actually just abuse in general. So if they had some type of abuse that's indicated and flagged within the generations, these are some things that a genogram will provide information for, whether a social worker, the treatment team, which our treatment team consists of a doctor, social worker, nurses that are on the unit, we have behavioral health facilitators that are on the unit with the patients. So all this information from the genograms would be beneficial for us to see the background of the patient that we're dealing with, if there's some domestic violence. So this is some information that will help us. So we kind of see, why the patient may be acting a certain way on the unit, whether if it's PTSD or if it's re-traumatizing or just reenacting another event that may have occurred through the past. These are some things that the genogram will capture. Family members. Additionally, the intervention. The genogram can be used as an effective intervention tool. Research has discovered that the process of creating a genogram itself is a therapeutic value for clients. So once you create one, it's a huge value for the clients that are there. I know for our patients, and I'm just looking at the patients at our hospital. If we were to create one for the family, I do feel that it would be beneficial for them to kind of see also, what kind of outlines their family history, the dynamics of it, and the more details, so they can have an understanding of their patient as well, of their child as well. So if we are actually getting this information from them and showing them, and being able to show them the genograph themselves, and explaining it to them, the possibilities of things that are that may be hereditary, and may be a pattern of different type of behaviors that have happened in the past in their family. These are some things that the genogram will capture, and it would be beneficial for for an intervention tool to see what has happened in the past, different family members going down the line. Additionally, genograms have assisted clinicians in understanding the origins of the client's behavior and the source of their presenting issues. And what I talked about, their behavior. So what was the source of it, where it came from? You can kind of look back from the moms, the mothers, or the mother's mother, of just seeing why this patient is acting a certain way, or why he may have issues with females. So we have a lot of patients that come on the unit, a lot of guys, little boys that are disrespectful to females, and we kind of look at that, and then we kind of realize that the mom was in an abusive relationship. There's a lot of domestic violence, abuse within her marriage, and so they were divorced. And so just looking at that in the genograph will show that even further back, that that her mother might have been abusive. So just seeing the pattern and seeing why this patient now that we have on our unit shows no respect to female staff, that the nurses that are talking to him, basically shutting down, cursing them out. And we can see that this pattern, this behavior is a pattern, because it's something that this patient has seen and witnessed in their home. The stepdad or the dad may be abusive to the mom. Therefore, this is learned behavior. This kid is learning these types of behaviors from the example that is set at home. And that example was set at an early age. So then, while we see these behaviors that are unfolding in front of us because of the family situation that's at home, and actually the genogram can even dig even deeper to see the mother's parents, if that was the same issue, if that was still a pattern, and something that maybe she was going through. Maybe as a child that she saw her mother, being abused or violently, physically assaulted or things of that sort. So, it can have a trickle down effect in the family. And then now she has a son, and this son is just real defiant, aggressive, gets admitted to a hospital, and we're wondering why he's so nice to certain men, different men on a unit, role models. He's an angel. He's following directions. He's being cooperative. But as soon as a female staff engages with him or tells him or sets a limit with him, he gets impulsive. He gets aggressive. And so these are things that we can see as a behavior issue that the genograms will help us uncover and unfold the underlying issues that's behind it. So this information assists the clinicians to create effective intervention recommendations that are based in a client's family system. So these genograms are definitely give us a bigger picture there. Medical applications. So we have the medical applications here. Information gathered from a genogram can include genetic, medical, social, behavioral, or cultural aspects of a family. So we have physicians typically obtain a frame of reference on a patient's genetic and medical information about a family. Nurses also utilize a genogram, but with an emphasis on the social, behavioral, and cultural aspect of a family. Their use as an assessment tool with elderly clients, however, has not been documented in the nursing literature. So just the medical aspect, the doctors can kind of see, the physicians that we work with can kind of see what medicine that their family's on. So if their medicine, if this family takes Risperdal or Seroquel and it works for them and it's beneficial, this can give the physicians I look like, well, if this is their child, maybe this is beneficial. Or on the flip side of it, that maybe they had an adverse effect. This medicine didn't work. This medicine made this father or more aggressive or have more suicidal ideations. So this is something that the physicians would probably steer away from because the father didn't have that success with this particular medicine. So then they're going to think of trying something else. But the genogram will capture that, and it'll capture in the details of what type of medicine worked for the family member, what maybe had an adverse effect. Then they can kind of get a capture of a view of what may work for this particular child that's coming in our care. So definitely beneficial. And with the nurses, same thing, utilizing these to, for a behavioral aspect that's on the unit. Evaluation tool for hospice care. So the genograms are a critical and non-threatening evaluation tool for hospice patients and their families. The genogram can provide basic information about the family, including the role of each member and the family dynamics. So these is definitely a great tool for the hospice care. The genograms can give hospice staff insight into dying patients, their family life cycle issues, relationships between family members become visible. The genogram can go beyond the patient's household to include supportive neighbors, friends, and community resources. So just in hospice, just kind of seeing, in hospice is the last care with these elderly, just to see what, the neighborhood, the support, just the relationships between family members that they're caring for. So they can get a big overview of, the patient that they're caring for, which could be their last weeks or last times with them, shared with them, just to know, what they were dealing with, what their relationship was with their spouse or different family members in the neighborhood. Religious and spiritual support is also noted. The information is used to assess families' needs and to provide interventions both before the patient's death and during the family's bereavement. So if this family is Christian, you want to, if this is what this family's rooted and this what their foundation is, then you definitely want to, practice that or engage and maybe let them engage in those practices there at the hospice. If they want to pray, if they want to, seek God and seek spiritual counseling with their last days, or the family wants to come in and and have that. We got to, be sensitive to that, and be aware of the different religious and spiritual support that may be needed. But the genographs will provide that information that would be beneficial in this hospice care environment. So in conclusion, and I just put that's all, folks. But finally, genograms are useful. They're a useful tool in creating effective interventions. They really are. If you want to go back into kind of what I mentioned, in the hospital, what we work with, different patients, and we have these patients that come in that are super aggressive, or just trying to find out why this patient is shutting down, or why this patient has issues with female staff, or why this patient has issues with, this being told no, or issues with certain types of medicine. The genogram will capture that. The genogram goes back several generations, just to kind of recap of everything that I kind of mentioned what a genogram does. It kind of goes back several generations, so you can kind of look back and see if, if the grandfather was bipolar, or if the grandfather was schizophrenic, or had different issues with his relationship. And so, if giving a kid a different type of medicine that may not have been working for the grandfather would be wise to know. And the genogram will capture that. Capture different diagnoses, medications, relationships. In my personal relationship, in my personal genogram, if I can be transparent, parents are together, they're married, they had different issues that they were going through. But like I mentioned before, my grandparents, they had issues with alcoholism, distant emotionally, and I found out recently that their parents actually had, the same thing. So for me, looking at that, and alcohol isn't a problem for me, it hasn't been, thank God, but can see how that could affect me, and I have children. So now, so that I have children, now I have to look at that moving forward with my kids, about how, that's in my family, with the alcohol and things of that sort. So these are things that we look at as clinicians, because I'm a clinician at the hospital, kind of look at, patterns in families, whether it's medicine, whether it's different behavior patterns from alcohol, or maybe even suicidal ideations. If it was depression, we look at depression. So that's a big thing now with the pandemic that's going on, a lot of depression. So we give kids that get admitted for depression, and we have kids' parents that maybe even attempted in the past to ingest pills, or to try to hurt themselves, and so, or they may have even witnessed their parents in sad situations commit or attempt to commit suicide. So that has an effect on their behavior. So all these things that family members go through, that we can make note of and capture for social workers, for doctors, and even for a behavior specialist, like myself, because I write plans for the kids and I'm a behavior specialist, is beneficial. So the genograms are a big tool for interventions. So because I can look back and see what needs to be done, based upon what I can see from family members and the behavior, and why they're acting out the way they are on the units. So then I'll put together a behavior plan based on that. But the background information, which these genographs are in detail, are very beneficial in these interventions that we make for the kids. So we can bring them down to baseline and just basically keep them healthy. And like I mentioned before, they're also beneficial for the caregivers, the parents. If we can have an outline for this, and it'll be maybe even enlightening for them to see that, wow, you know what, my parents did have this, and this can explain why, why Johnny's acting the way he is, because I dealt with this, and get in detail. So it can be enlightening for the parent when they look at a genogram. So these are things that we can kind of like put into practice, whether we're in social work, whether even in counseling. And if we get a genogram and seeing the dynamics, and even bringing it to our client a client's perspective and let them see uh, the family tree, and not just the family tree, but the family tree in detail, which the genogram is. So I want to thank you for listening. I want to thank you for participating and yeah, just listening to my presentation. I appreciate it, and God bless.